Are you here for a report? Oh my gosh, that's awesome. The last couple days, it seems like I haven't been able to get out of here till 7:30 or 8, so this is awesome to get report started on time. You've got, looks like all four of my patients. Honestly, it's not been a crazy day, so hopefully you have a good night with them. I start in 213, so we can start there. 213 bed 1, and that's the bed by the window, is Miss League, Ivy League. She came in complaining of some lower back pain. She does have history of CAD, congestive heart failure, hypertension, and some high cholesterol. I think her physician, Dr. Glassman, was just wanting to rule out everything because in the past, some of her heart stuff has caused the lower back pain. I've been working with her on her pain throughout the day. Honestly, I can't get it much lower than a 4 or 5, even with her pain medications. Also noticing that she is having trouble having a bowel movement, so we're increasing the fluid intake, and I do believe I gave her some help getting her walking around, that type of thing, but she does not have anything ordered to help her go to the bathroom. She's alert and oriented. She's very pleasant. Even with the pain, 5 out of 10. I feel like she follows orders and directions well. The rest of her assessment was unremarkable. They've done some blood work and things, and they've kind of ruled out her any heart involvement with this, even though she does have that CHF and the CAD. But she's got no weight gain. She's got no swelling, and her breathing is fine. I do expect once we get her pain managed that she will be discharged, but we might need to keep the eye on her whether or not she can have a bowel movement too, because that might be part of her pain issues. Next to her in 213 is Quentin Pye. Quentin is a young lady who came in complaining of shortness of breath. They ruled out COVID. Her tests were negative. She's got no fever, but she has a pretty nice wheeze going on and this dry cough that's been going on for a couple days. They ended up diagnosing her with asthma in the ER. She also does have a history of seasonal allergies. They did decide to admit her for a couple days, I think because she's young, she's living in the dorms, she doesn't have family here, and they wanted to make sure that they could get her breathing under control before she went back out in the cold and went back to the dorms and something worse set in. She's alert and oriented. I think everything's fine. She does have, like I said, some anxiety. I think being here is a little bit hard on her. So we did get some blood work done today. I just got the results back and it looks like her white blood count is up, so there might be something else that is beginning to be brewing there. She's got medications for her asthma if it starts to flare up on her, but she's been pretty good for me, 93% on room air, and that's with her talking and walking and going to the bathroom and that type of thing. Next door, we have two gentlemen. The first one is Mr. Payne. He's in bed 1 by the window. Mr. Payne came from the nursing home. They were having difficulty getting his blood sugars under control, so they sent him in. He is a DNR. He is alert to person, not really to place or time, but he follows directions well. His blood sugar today was 202, and that was a fasting finger stick blood sugar. Did notice some decreased pedal pulses, but that's nothing new to him. He has a history of diabetes, CAD, hyperlipidemia, hypertension, and AFib. He is a DNR. Dr. Glassman is following him. Also got some blood work done on him. It looks like the results are in, but they were not in when the doctor was rounding on him earlier today. Next to Mr. Payne is Mr. Dream. He's in 214 bed 2. He is a gentleman who is pretty much homebound due to obesity and mobility issues. He was getting out of bed and apparently fell and landed on his left leg, which resulted in a left femur fracture. That was repaired 1 day ago, and he came in to us down to the unit this morning. He is complaining of pain, 7 out of 10 in that lower left leg. Both extremities are warm to touch. His pedal pulses are present. He had a bowel movement the day before surgery. The rest of his assessment today was fine. He does have a history of hyperlipidemia, hypertension. He is pre-diabetic type 2. His blood pressure was a little elevated today. His SATs have been fine on room air. He remained afebrile. He is obviously not getting up and moving around, but he's alert and oriented. He's been sleeping on and off today, but he's easily aroused. He received all of his medications this morning. He's on an antibiotic and some normal saline, but he's starting to eat and drink normally, so I think they'll probably stop the saline. He does have some PRN medications if needed, but he's been pretty good. I think once we get the pain controlled on him, that will be fine as well. So do you have any questions for me? Again, 213 bed 1 is Miss League. She came in with the back pain with the history of some heart stuff. 213 bed 2 is Miss Pie. She's our newly diagnosed asthmatic, but COVID was ruled out in the ER before she even came up to us. Mr. Payne is our DNR patient from the nursing home who had uncontrolled finger sticks. They've not been able to get those down. And then Mr. Dream is our status post left femur fracture, who at this point I think will be, once we deal with his pain, that he'll be probably discharged to rehab within the next day or so. If you have any questions at all, I am going to be kind of cleaning up a few things, finishing my charting, but I would like to get out of here by about 7:30. So if you need anything, just holler at me, and then I hope you have a great night. Thanks.